how do you see your organizations now sort of adopting that stance? I mean, you see AI as this major transformational technology. You're in the for good business, if I can say so. What's your plan? Maybe we start with Charlotte.
So thank you, it's great to be here. Yes, I think it is the subject of the moment, artificial intelligence. If I look at the International Committee of the Red Cross, whose mandate is to protect and assist victims of situations of conflict and violence, there's not an evident link, and so people wonder why the ICRC is investing in machine learning, artificial intelligence. I think we can group it under sort of four subsets. The first is really to understand the operating environment we're in, and which is increasingly digitalized. More and more conflicts are happening in urban areas or countries that have large-scale use of technology. So it is a way to understand the operating environment that we're in, not just our physical proximity, but our virtual environment too. Second, how can we improve our capacity to respond to victims of armed conflict? There are massive needs today, massive humanitarian challenges, and can machine learning help us respond to those? The third area, a bit more complicated, is around the means and methods of warfare, because what we're seeing is AI increasingly being assessed or used for autonomous weaponry or as a means of conducting warfare. And so that is an area where, as the ICRC, as the guardian of international humanitarian law, has to look at the issues of compliance with international law, but also pushing for the legal, ethical, policy requirements to be taken into consideration in the development of things like AI for weaponry. And lastly, to look at how all of those things could impact victims of armed conflict. So privacy, data protection, and also the ways that they may be targeted. So how do we build awareness of the impact of AI and other new technologies on victims of armed conflict?
Mm-hmm. Okay. And Ramesh, how do you?
First of all, Marcel, thanks a lot. This is thank you for inviting WHO, and I'm so impressed with the human capacity that's in this room about AI for health and AI for good in general, and what these people can do to transform the public health agenda. As you all know, World Health Organization is a United Nations body for health, and we have a mandate for coordinating the health agenda for the world. So with that said, there are 194 member states that we work with, and we have 6 regions that we cover. In all of these 194 member states are being arranged to accordingly for us to work with them. The broader question is, health is a big agenda. It's a colossal agenda for the country. So if you think about digital health as a enabler, then the machine learning, artificial intelligence, everything else come under. So in the very broadest sense, countries need to have enabling environment in order for highly technical aspects such as high-speed computing to machine learning to artificial intelligence, even in terms of academia, in terms of policy, in terms of approaches, in terms of having a sufficient money to have a storage environment, cloud computing environment, and data warehousing environment. I mean, there are many, many, many facets to this in order for governments to make decisions for taking AI to the next level. So with that said, I think our current Director General, Dr. Tedros, has very clearly stated, even in the recent Executive Board meeting just a few days ago, to member states that digital health is square and center among the 3 principal objectives as one of the enablers, within which I think in the AI for Good Summit that ITU organized very recently with WHO and 30 other agencies, and UN agencies participated in it. There was an AI for Health track, and I think you were principally organizing that and moderating, as you know. That led into us being now more focused on what the country needs are. And we are not the AI entities in the United Nations system. We are the policy advisor to the government. So if you were to take the AI technologies and ask the government to implement, then we need to help facilitate that process to make it happen. So the 3 things that we are now seriously thinking about is, number 1 is, do the national capacity exist? insofar as adapting AI technologies, both public and private sector. Call it as a public-private partnership in a big level. Second one is, do they have a mandate to make it happen? I mean, if you don't have a mandate, most of the private companies don't venture into because tax incentives, regulations, and so on. And then the third one is, what are the critical needs insofar as health sector is concerned, and where do you actually focus on making this happen? So it's not like randomized way of taking a problem to solve, but what are the country priorities? And that changes from country to country. So this is kind of how we approach at the national level when we advise ministers of health.
Okay, but so just to pick up on that, I mean, so you said, okay, so we are not the AI experts, right? And nobody would expect that. I mean, we would expect you to be the health experts.
Correct.
So where do you get the expertise, and how do you then sort of incorporate it into this, what I imagine must be a hugely complicated regulatory organizational process?
Yeah. So
I mean, given that we see that a lot of companies seem to be struggle to integrate AI,
right.
I don't know exactly the ins and outs of WHO and ICRC, but I assume it's even more complicated. Mm-hmm. So how do you do that?
So I think if you take back one step and ask a principal question about how do countries prioritize health agenda and what problems they're solving. So I'm just giving you a rough idea. If, let's say, hypertension is a major problem in many countries, and reduction of hypertension, or retinopathy, and I think the example that Jeff showed insofar as solving that problem, if countries pick up that as a major NCD, non-communicable disease problem to address, then country resources is going there. And now, as technical advisors, we need to bring engineers and scientists and policymakers together to discuss what are the best approaches to do a scale-up, if you were to scale up. Because private sectors are doing independent of public sector investments. They will do anyway, whatever they would like to do. So we have to bring them together. So WHO is now working with ITU in creating in establishing the focus group for health, as you know very well. You're one of the vice chairs. This focus group is a mechanism for us to identify key public health areas to which AI can be a potential enabler and answer to go forward. So that means we have to, first of all, discover what problems we are trying to solve. Second, whether they are country priorities. And third, bring the engineers like yourself and like many of you here could actually potentially participate in that process. So in a way, the answer is in this room, in this AI for Health focus group, and in the public-private partnerships that we are working with. Second one, I think, is that in country, there are many capacities. Like if you take, especially Western Europe, many countries have a lot of capacity. Insofar as utilization of AI, they're advancing quite well. So we have to borrow those experiences. Because WHO is neutral to countries, and all countries who are members of WHO needs to get the advice, we need to have a facilitated process. Yep. I think operating at 35,000 feet and then coming on ground and solving one specific problem, we have to have a relationship and a logical sequence. And I think I propose that for you.
So for ICRC, actually 5 years ago, we started to look and say, well, what are some of the big challenges we're trying to resolve? And actually, we came to EPFL and talked to EPFL and said, what research are you doing in the field of AI, and how could that apply to some of the big challenges that we had? And we started there to develop algorithmic reading specifically to ICRC's needs, and then looked at trying to pilot that in a couple of contexts to prove the case to those people on the ground of our staff who are going to have to use it, because it's all very well and good coming up with a great use case, but if nobody actually knows how to apply it or is not going to integrate that and change the way they work, then it's not going to have a utility. So we really picked some big use cases where machine learning was the only way forward. So mass-scaled data, in this case public data, and trying to look at, could we apply algorithmic reading to that in a way very specific, an ontology very specific to the ICRC's needs, and then testing that and seeing, well, did it tell us anything? And some of the contexts we first tested in, we looked, and the algorithmic reading was telling us there is a water problem in this particular district, and so we asked our water specialists on the ground, go look. And there was a water problem in that particular district. So as soon as you can actually demonstrate the use case, and something that we wouldn't have been able to do, we were within what we call near real time, so 8 hours from something being posted, then we could actually say, well, that is an added value to what we're already doing. So really good use cases. At the moment, we've come back a year ago with EPFL. We've got an ongoing research agenda with EPFL. And we came back and we said, well, there are currently nearly 70 million people on the move linked to conflict, migration, and violence. So one of the big humanitarian challenges is actually connecting people who've been separated because of war and violence. And everybody assumes because of technology today, that's a very easy thing to do. You go onto any of the big social media platforms and you will find your relative. Well, actually, it isn't the case because either people have not got connectivity or lose the means of connecting when they're in flight or are afraid to connect. And so they come to an organization like the ICRC, which has a mandate to reconnect families or to try to find the fate of people who are missing. And so we came and we said, right, we're very interested now to look at algorithmic reading and data fusioning techniques with overlaying facial recognition technology. So, and then we had to look and came up with some of the very real biases that were discussed by our previous speakers. For example, facial recognition technology, if you are white, male, Anglo-Saxon, and you go missing, good chance of being found. Any other nationalities? Sorry. So that is something where you have to start retraining the machine. So that is something where we can then partner with somebody like EPFL and give very big research challenges. But then we can test the research which comes out, which is often one of the complexities for a research organization. How do you then test? Mm-hmm. We can test what comes out of that and then start to refine that and build that and start really long-term projects. None of these are quick wins. Mm-hmm. To really try to find collaboration with a view of looking at big challenges, testing those, and then looking at how do you scale those in organizations. And our previous speaker spoke about that, but that is one of the big complexities. How do you then build to scale inside an organization?
Yeah. Okay.
Could I add one
Sure.
piece? So, for what we have recognized in the last maybe 15 or 20 years, data standards becomes a big issue for many decision-making processes, including using the data that is what you call not conducive for AI to make AI decisions. I think this is an area where we need a clear understanding what is the minimum requirement for insofar as standardization of electronic data. We have electronic medical record standards, we have EMR standards are not widely adopted, and in those countries that are still in the paper-based systems, this is far away from what we are discussing right now. Mm-hmm. But there are countries where multiple standards exist within the country context. So when you're sampling the data for training purposes in the AI methodologies, we would like to know at the level at what is the minimum standard that is being used, mm-hmm. whether those minimum standards are largely agreed by the engineers to the point where we can begin to make recommendations.
All right.
So that the countries can be prepped to that part.
So that's a great segue into one of the questions that seems to be very popular on Pigeonhole, which is what is the strategy of WHO, but we can also talk about ICRC, to make such data publicly available for research and for new digital services backed by machine learning and AI?
I think there are maybe three things I can say about this. Number one is, in the country context, in the national boundaries context, data policies are determined by the national agencies, health authorities, and the other digital authorities that is linked to the data. So if you are using a national data that are identifiable for certain reasons that you need to have access to, or unidentified data with a level of granularity that you need, such as an EMR but not identifying the name of the person or the geolocation of the person's residence, then the national government has to help facilitate that process. So we are trying to push the open data policy for these countries, understand what is open data, understand why the countries need to have an open data policies, and how to go towards establishing those policies and make those data available. That's one. Second piece is WHO itself gets member state data, anonymized, aggregated data. But the aggregated data are not conducive for all aspects of AI, but certain parts of AI. So we are making that available. And the third is, I think, we have to kind of ask ourselves a question: what is the use case? What kinds of data types you need? Then we can actually have a specific conversation about either promoting or harnessing the data that we have accessible in consultation with member states to give that for researchers to use. So those are how the three ways we approach this.
How do you see this, Charlotte? Because I assume, much of the data that you deal with is fairly sensitive, I assume. So how do you bridge that gap?
Yeah, so the ICRC holds an enormous amount of data on individuals who are in highly complex environments. And so data privacy, data protection is a critical aspect. 5 years ago, we didn't have one data protection lawyer. I now have 8 data protection lawyers in my team. We deal with more than 120 data authorities. So there is an important aspect, and we're an organization which has privileges and immunities. So we don't hand over data, and we don't share data publicly unless there is a very specific, not on individuals, but maybe on trends more globally. So privacy is a critical aspect, respecting data privacy and consent, and we do data protection impact assessments on any of the technologies and the work we use. We've also been running for the last few years a privacy and humanitarian action series where we bring together academics, tech specialists, as well as humanitarian actors to look at certain emerging technologies. We looked at big data a few years ago. We're looking at AI, digital identities at the moment, where we look at the legal policy and operational and technical requirements that would be necessary for the ICRC to use that. It also requires, as organizations, that we adapt our policies and processes. At the moment, we're finalizing a biometrics policy because, of course, a lot of the data that is used is highly sensitive and can be disaggregated back down to an individual, which for our type of work is highly complex for individuals. So the data privacy, data protection, how you aggregate is critical, and how you encrypt. And I think at the moment, we're still looking at what are the best scaling options in ways that protect the ICRC's privileges and immunities, respect data, make sure where there are data embassy agreements that will allow us to make sure that we can respect and protect data that is handed over to us. And I think the last aspect I would just like to mention is consent of the individual. And something ICRC is advocating very strongly is that data collected for humanitarian purposes should remain only used for the purpose for which it's collected. And that we have to recognize that many people are not in a position to really understand what consent means, particularly if they're in highly vulnerable situations of conflict. And if they feel that the requirement to access humanitarian aid is to hand over increasing levels of granularity of data on themselves, then this cannot be an appropriate way forward to respect the individual and respect their safety and security. So those aspects we advocate for as a humanitarian organization.
Okay. So another question that is mentioned or that is asked is about more specific projects. Are there examples you can give where you are either intensely working on or where you've already seen AI being useful in your organization?
Yeah, we have one that is going on in public health surveillance, large-scale data analysis, but it has a dimension of public health surveillance in the EMR space because some of the cases being followed. So we're talking about thousands of cases in a country X, let's call that, and where we are now beginning to understand 3 or 4 different dimensions of how we can actually use AI, but we are experimenting now, getting the pattern recognition process going on one side. But we're also doing the EMR analysis. I think it was Jeff who was showing a piece of document about the EMR, even actually unstructured data that we're trying to figure out, in extracting the analysis for kind of understanding the pattern of the primary complaints that are coming in and the kinds of forecasting. The second part we're doing is, can we use the public health surveillance data to forecast for stockpile management for influenza cases or for other, including antidotes for antivenoms in some countries. So we have one very specific country that has qualification of all kinds of problems in this particular box, and we are trying to piece out the kind of data sets and the kind of problems that we need to solve that is not easily possible. That's one. The second one, I think, is centralizing the radiology imagery and then creating a process as a second consultation to aid the radiologist to come up with the proper diagnosis of a given reading of an imagery. That's another one that we are trying to do right now. Okay. And so those are the 2 very specific examples, I think.
So the algorithmic reading that we developed, the ontology and algorithm that we developed with EPFL actually has already gone into it's a startup now. And that is already working. We are able to use that in contexts, in pilot mode. We know it works. Now we're working out how to scale that because, of course, each context has a very, that we work in, and we work in more than 80, has a very specific ontology of language specific to the humanitarian environment in that setting. So now we're looking at how do we scale that across different contexts. So that one definitely in how we in terms of how we use algorithmic reading, machine learning to read the conflict environments that we're in. That one we are already adopting inside the organization. We're piloting many different aspects of that. We're looking at now how do we use the same ontology for hate speech, for patterns of migration and other things. So we know it already has an application in the humanitarian setting. We're now looking at how do we scale that in the relevant environment to enable us to use it and do no digital harm and ensure that we have the right environment in which to roll it out.
Okay. There are a few comments and questions around the topic of hiring. So I'm going to take that as a sort of summary pool of questions, sort of saying or asking, how do you onboard talent like that, right? I mean, we heard before from Michael that's one of the challenges, right? Getting this talent on board because
Right.
it's still rare. And of course, the Googles and the Swisscoms are, to some extent, in some advantageous situation because they're tech companies to begin with. You're not. On the other hand, what you do is something that's very attractive. What's your experience there? Do you find that hard to attract this kind of talent, or do you rather? Would you say it would probably be easy, but it's actually internally that I, as sort of the digital pioneer, first have to fight for an understanding of this?
So I think definitely we're all battling to get the same pool of expertise and knowledge. And I think data science in terms of an organization like my own is relatively new. So it is attracting and retaining talent. I think the humanitarian imperative and tech for good is a good enabler to bring talent in. We have to then create the environment in which they're ready to stay, i.e. they can then really work on these big challenges and big and humanitarian purpose-driven needs. But it is then also looking at what is your data and your analytics strategy across the organization, which are much more systemic things inside the organization. And I think there we've definitely had to recognize in developing our own strategies how to do that. And I think one of the critical aspects for us was also ensuring that the digital transformation driven by data was part of the institutional strategy of the organization, so adopted at our board level, which recognized what we're trying to achieve, so it's not seen as a sort of side product, nice if you can get it off the ground, but we're not going to invest in that, but heavily invest inside the institutional strategy. And I think that was one of the keys for the ICRC, both in terms of recognizing the vision of where we're going and then the increments of how we'll get there, including bringing staff in.
All right. Ramesh.
I think for WHO, there are two answers I could give. One is internal hiring inside WHO. We look for data scientists who have a very good understanding of vertical program areas. I mean, here is TB specific, malaria specific, HIV specific, because they have a granularity and etiology of diseases that are very specific. You need to have that kind of a knowledge base. Call it as a biomedical informatician or a public health informatician who would have the all-round. But what we are now doing is we are finishing up a position paper to give to countries to take into account the data scientists that they need to begin to nurture properly in a systematic way to address big data analytics, AI, machine learning, in relation to problem A, B, C, D, whatever the country needs are. That means they need to have public health informatician, biomedical informaticians, nursing informaticians, things that are highly specialized in a very specific area. And they need to be employed and nurtured and capacitated. And most of the countries don't have a job description. So you don't apply for an AI engineer. There's no AI engineering post announced in a country. So how do you make them available? So you have to talk to the Civil Service Commission, change the job description or introduce a new job type. If you take the United States, there's no public health informatician job title up until 5 years ago or 8 years ago. It just is a brand new idea. Now, if you want to introduce all of these talents in this room to be, let's say they're all students today and they want to be employed tomorrow, what job they would apply in which country? So that means the job descriptions and the job types and the job regulation authorities need to be empowered to make sure there are certain job profiles. And we need to make sure that matches with, in this case, public health. In our case, it's AI for health, let's say in a broad category. That means we have to create a list of job profiles. So our position paper is addressing to the ministers to make sure you work with the Civil Service Commission to make sure that you create these job types. As a result, that will, and then we have to talk to the universities to create curriculum that will enable these job types to be filled with the right experience and right academia, right technical expertise and skill sets. So it is all like we have to reverse engineer. So if you do a lathe operator today, there is a very good lathe operator definition and a very good job description, but there's no very good job description of AI for health engineer.
Sure. So. All right, I'm mindful of time, so maybe in 1 or 2 sentences, what's, if we meet again in a year, what's your goal in terms of applied machine learning days or applied machine learning in general for your organizations? What would you like to see have achieved?
Maybe for WHO, we have a target of, we work with governments in terms of digital health strategy. In the digital health strategy, the national digital health strategies are those document that mandates the government to do ABCD in terms of capacity building. The previous versions of what we call as e-health strategy did not account for artificial intelligence and machine learning. So the new digital health strategy is encompassing those elements and then articulating what all the strategic investments that the countries have to make, which all the things that we just discussed. So that is our goal, and we are hoping that X number of countries, we have a target that we are discussing now, out of 194 member states must have at least a draft digital health strategy and innovation strategy.
All right.
So within 1 year, we hope to have clearly identified in our field delegations how to integrate these machine learning aspects into their work and the pipeline of what it will be required to do that from staffing, but also ethical and legal requirements to do that. Secondly, that we have actually managed to resolve the cases of missing people, so we can work out that the technology can work to do that, so that we can look at how to scale that, all while respecting privacy, data protection, and making sure that we experiment in a lab environment and not on people. And the last point I would make is that we still continue to influence around that decisions to kill or destroy, so in the means and methods of warfare, are still retain human control and not made by machines.
Not made by machines. All right. Well, I think I speak on behalf of everyone when I say we're rooting hard for you, because if your organization succeeds, we will all succeed. So good luck on those missions. And thanks for coming.
Thank you.